Okay. So this patient has ocular melanoma, and you can see that they've got this big metastasis in their liver and then multiple additional metastases. So like this one, this one, this one, this one. So lots of small little arterially enhancing metastases. Ocular melanoma likes to go to the liver, and it's also very like aggressive. And so sometimes they say these patients have like 6 months to live, basically, because it just starts taking over the liver. So I recently saw a case that was a follow-up to an IR treatment to this that I didn't know about, so I thought I would share it with you guys. And so the treatment is called Melphalan. And so basically, Melphalan is a mustard alkylating agent that causes severe cytotoxicity to both multiplying and non-multiplying cells. So it's very, very toxic. And usually they use it to treat multiple myeloma, where like the patient's really, really sick and they're going to do a stem cell transplant, and they use it to annihilate the bone marrow. But it's also actually very good for melanoma, except if you sorry, give it systemically, it can be very toxic and it can send the patient into aplastic anemia. Mm. So what they're doing now is something called isolated hepatic perfusion for melanoma. And there's multiple sites around the country that are doing this. But basically what you do is you do a double balloon occlusion of the IVC. In this picture, it looks like you're ligating it. You can also do it intraoperatively. But you basically close off the IVC above and below the liver. So you're isolating the liver. That's what isolated hepatic perfusion means. You can do this for other agents as well. Then that's really, really dangerous because you basically have like no preload. So you have to do this in the operating room with surgeons and anesthesiologists. And so as soon as block off the IVC, they actually take the patient's blood out and they infuse it back in at a rapid rate through their internal jugular vein. So they're basically on ECMO. And then after they do that, they get their microcatheter into the hepatic arteries, and they infuse this Melphalan into the liver for about like 4 minutes into each artery. And then for the next 30 minutes, they suck the blood off of the hepatic veins, put it through a filter, take the Melphalan out, and then put that blood back into the patient's body.
Wow.
Wow. Does that make sense? So anyway, we had a case here. So we've had like 4 patients here. So it's not that frequent, but apparently most of them are being done at Jefferson and a few other sites around the country. So this patient was really, actually they were in Mexico. They came up for this treatment. So just my angio images, they didn't really work properly, but I just have a couple of still images. But this basically shows you the double balloon aspect. So they put a balloon right at the top of the hepatic veins and at the bottom, and then make sure that the hepatic veins are still here. And then they would basically go into the left hepatic artery and infuse the agent. And the follow-up scan was this one. So almost all of the lesions went away. This is just a perfusional abnormality. But interestingly, they now developed several new lesions in their caudate lobe. Mm. So we hypothesized, or we didn't know really what feeds the caudate lobe. So I was like, maybe there's an aberrant vessel like the adrenal artery or the phrenic artery. Because I know for HCCs, and even for this actually, they have to map out all of the arteries because HCCs can, like for example, a right lobe HCC can parasitize vessels from the diaphragm, the phrenic. And then if it's a segment 5 one, it can actually parasitize stuff off the kidney. So if you're going to like Y90 or TACE it, you got to like make sure you go into those parasitized vessels that are aberrant. So anyway, we said, oh, everything else, all the other lesions are gone, but these caudate lesions are growing. Maybe there's some abnormal flow to the caudate. So I did some research, and the caudate basically is almost exclusively fed by branches of the right and left hepatic artery, often like small branches of both of them. But what they think that happened was that there weren't any caudate lesions to begin with, so they put their microcatheter kind of further into the liver. So they basically kind of bypass the caudate lobe. So anyway, I just thought it was kind of an interesting case of treatment of melanoma using this Melphalan isolated hepatic perfusion, and then a few lesions growing because we missed that kind of hepatic perfusion in that area. They're planning to now Y90 this area to kind of radio embolize it.
What was the time interval between treatment and that MR?
So actually it's 6 treatments, and it's a big deal. Like they have to go to the OR, and there's lots of stuff that happens there. But yeah, this guy's doing well and stuff. So they did it 6 times. So actually each time the Mets were disappearing.
Wow.
Wow, so that
That's really incredible.
Yeah, the balloon exclusion of the hepatic, they did that 6 each time.
Yeah, yeah, in the operating room with a surgical oncologist and
wow,
everything. Yeah,
that's amazing.
What's the long-term data on this?
I think it's. I tried to look it up, and it was like there are 14 patients from like 5 institutes. So it's like this is a rare thing, I understand, but like I didn't even know that they could do that. That there was this process that you could isolate the liver and start doing hepatic infusion, therapy to it with like higher toxicity agents. So I thought that was interesting. Yeah, there was one article that said that actually the patients do very, very well, but it was like literally 15 patients from like 4 different institutes. Yeah.
That's still pretty good data if they all do well.
Yeah. Yeah.